your primary care provider. It's super important these days. We're getting more specialists, more in new medications, different ways to diagnose and treat illnesses. So you need someone who's going to be your quarterback of your healthcare to guide you through health prevention as well as illnesses when they occur. I'm Dr. Bobby Tassin, and I'm the physician supervisor for Healthy Heart Clinics. So primary care is going to be what you may have thought of as your family doctor. You want someone you've got a relationship with, so you can call that clinic and that provider when something occurs, and it may be able to handle through a telemedicine visit, a phone call, or a quick visit, as opposed to maybe having to go out to an urgent care or try to find a specialist who may not be available. That provider may not know you and your history. So having that background and knowledge enables your primary care provider to give you efficient and care that's appropriate for you. If you do see specialists and you've got one or more physicians or providers prescribing medications, they may not be focused on the big picture. And that's extremely important to have someone who reconciles all that information, figure out, are all of these medicines appropriate? Are they working for you? Is there any interaction or problem that might be occurring that could be affecting your health now or potentially in the future? We all try to look at the big picture, but what we do is a complete review of a person's past history, their family history, their social determinants of their health, lifestyle, including diet, exercise, occupation, family situation, all current medications, allergies. That's the basics. Beyond that, we want to provide patients today with data. I feel like information is powerful. So for example, if a person's dealing with hypertension and they have a home blood pressure monitor, they can use a home blood pressure monitor and input that data into the CardioCare application. We can see the results, they can see the results, we can see trends. You can see what happens, good or bad, based on what happens in their daily life, what they eat, what kind of stress they're under, that sort of thing. We have an eye to the future when it comes to advanced diagnostic testing, whether it be genetic testing, diagnostic imaging changes. So we keep an eye to what we can do now efficiently, and we do want to be cost conscious, and that's important when you come to primary care. So a health risk assessment is a comprehensive review of the factors in you as a patient that portend higher risk or lack thereof for certain illnesses or problems down the road. And again, this comes with your family history, what you eat, what you drink, what is your lifestyle, what are your risks for health problems in general. So this could be cancer, this could be cardiovascular disease, this could be diabetes, this could be behavioral health problems, this can be dementia-related problems, this can be fall risk in the elderly or people who are otherwise perhaps partially disabled. So we take a look at anything in your world that can affect your health risk and try to identify those issues so we can work with you to alleviate them, prevent them, or treat them. So genetic testing, in our view, is a helpful tool. Not everybody needs genetic testing. If you go and talk to a patient and review their history thoroughly in terms of, again, past medical, family history, social determinants, you can determine with conversation who may be at higher risk for certain types of cancers. There are even now on the market today blood tests that you can get to evaluate if you may have cancer already. So one of the things we do is look to the future, what's coming down the pipe, see what we can use for our patients' benefit going forward. So in strictest terms, annual wellness visit is basically a Medicare patient population visit, and it is more or less a review and a health risk assessment. So it's by rule and regulation not designed to be a treatment visit. So you're basically taking a deep dive, making sure you have all the details of person's demographics, So the wellness visit is just a deep dive and review, and it gives us a plan going forward. So basically, you can identify what screening a person is due for and what they should be planning to do in the next year, 5, and perhaps even 10 years out. Another focus on the annual wellness visit is advanced directive planning or end-of-life care. What would you want to do when your time comes and you may have a terminal illness or a serious injury? How aggressive of a treatment do you want? And this can be very basic plans, or it can be very detailed. You've got a team of individuals who work. Part of that team can be a healthcare coordinator or a health coach, and that can be someone who is working with you on a day-to-day or week-to-week basis. For example, if you've got a chronic illness or two, you're dealing with hypertension and diabetes, you're not going to have the same benefits seeing a doctor once every 3, 4, or 6 months as you would monitoring those issues and working on all the factors that impact those issues through someone like a health coach or a care coordinator. They can be in touch with you on a regular basis and review all the pieces of the puzzle that make up a successful treatment plan for that illness. Other health coaches may be more in the prevention and wellness and performance side of life. So some folks are not having a chronic illness, but they want to prevent it, or they want to get better in some regard. Maybe they're looking to do better with their physical activity. So they want to focus on nutrition to build muscle, increase speed and agility. So they may have a fitness coach, and that fitness coach can focus on physical activity. They may have a nutritionist, and that nutritionist can focus on performance-based nutrition for that individual. So the spectrum ranges from helping you to care and control chronic disease, prevent disease, and perform at your best. Thank you for watching this video, and for more information, you can go to healthyheartclinics.com.